Good evening, ladies and gentlemen. Today we'll be demystifying the myths surrounding rectal bleeding. We have reasons why people bleed from the rectum. Now, before I go further, let me explain what the rectum is for those who don't really understand basis of anatomy. Let me just break it down to the layman term. The anus is actually the continuation of the rectum. The rectum is a bulge part of the end part of the large intestine that accumulates feces. It accumulates feces like a storage ground for accumulation of feces. Once it has expanded to a certain limit, then you feel the urge to pass stool. That part that stalled the stool for some time before you eventually pass it out is called the rectum. It's just a continuation the anus is actually a continuation of the rectum. What differentiates them is what we call the dentate line. It's just anatomy. I'm not going to dwell on that. But before we get confused, so I had to explain what the difference between the anus and the rectum. The stool comes from the rectum and then to the anus, then before it goes out to the outside world. Now, there are reasons why some persons will bleed while they are passing stool. There are reasons why some persons will bleed while they are, straining. Among the reasons include one, hemorrhoids, the one they call pile. When someone, pass stool, can bleed, such in hemorrhoids. Issues like infections, for example, some persons will have infections of the large intestines, especially with salmonella, and then they will have typhoid. When it is perforated, they can actually bleed through the anus. They can develop what we know as peptic ulcer disease, either duodenal ulcer or gastric ulcer, and this can result to bleeding per rectum, bleeding through the rectum. Some persons could have we have ulcerative colitis, Crohn's disease, diseases like angiodysplasia, colon cancers, even sometimes rectal prolapse. I'm going to differentiate the differences, see the differences between rectal prolapse and hemorrhoids. Many persons confuse both of them, especially our senior colleagues called the herbal guys, the naturopathic or gas. They cannot differentiate between hemorrhoids and rectal prolapse. Anything that comes out from the rectum is hemorrhoids. So, but today I'm going to demystify the difference between rectal prolapse and hemorrhoids. All right. So, but today we've seen that one, angiodysplasia can cause rectal bleeding. Hemorrhoids can cause rectal bleeding. Peptic ulcer disease can cause rectal bleeding. Infections such as typhoid can cause rectal bleeding. Diverticulum can cause rectal bleeding. Angiodysplasia can cause rectal bleeding. All this I will not discuss, but I'll focus on hemorrhoids, rectal prolapse, and vis-a-vis I may talk on colon cancer, because it is very, very common in our society. Many persons, they end up not even knowing what colon cancer is, not knowing that it is even much more common than even breast cancer. Now, let me start with the hemorrhoids. When we say hemorrhoids, what are we talking about? Hemorrhoids are actually distension of anal cushions. There are structures in the anus that cushions the structures in around the rectum. These structures, they are called when they are filled with blood. Sometimes they are dilated and they are filled with blood, and what happens? They eventually comes out through the anus, and this is known as hemorrhoids. We have two types of hemorrhoids. We have the the internal hemorrhoids and the external hemorrhoids. Apart from this, hemorrhoids can now be classified into first degree hemorrhoids, or the primary hemorrhoids, second degree hemorrhoids, and third degree hemorrhoids, and even the fourth degree hemorrhoids. Now, when hemorrhoids are dilated, when these anal cushions are dilated, and person continue to strain. When he goes to toilet, he keeps straining, he has long-term constipation. This person do not eat high fiber containing diet. The person keeps straining, always having constipation. There's high tendency that this person can develop hemorrhoids. Okay, now when this happens, sometimes the hemorrhoids can come out from the anus. Sometimes they are just situated outside the anus. When they are just situated outside the anus, they don't go in, they are just outside the anus. This is called external hemorrhoids. But when they are inside the anus, when you strain, you go to toilet, they come out. This is called what? Internal hemorrhoids. Now, we have these hemorrhoids. In primary hemorrhoids, sometimes they bleed, but they don't come out. You just go to toilet, you see blood you pass through, you can see that the water turns red, but they don't come out. This is what? Primary hemorrhoids. Okay, you just see that you are losing blood. Gradually you are losing blood. The secondary, first degree hemorrhoid. A second degree hemorrhoid, sometimes they come out automatically after you are done with passing stool. They go back on they also bleed too. You don't feel pains. There's no pain. This is what? Second degree hemorrhoid. Third degree hemorrhoids, sometimes they come out, you feel pain, and you have to use your hand to push it in again. This is a tertiary hemorrhoid. Secondary hemorrhoids, you cannot. Fourth degree hemorrhoid, you may not be able to push it in. You can't. It's difficult to push it, and it is quite painful. This is what? Fourth degree hemorrhoids. It is very common that because so many persons, they no longer eat high fiber food, they strain, they have long-term diarrhea, they strain, they have constipation, they may develop hemorrhoids. Now, how do you treat hemorrhoids? There are ways, depends on how hemorrhoids present. Sometimes, if it is just first degree hemorrhoids, you advise the patient or the person to do what? Sit baths. How you do sit bath is you take a big bowl of water, you put salt inside, and ensure that it is saturated with salt, and you sit in it for like 30 minutes. This is for primary hemorrhoids. Same thing with secondary hemorrhoids, second degree hemorrhoid. Why third degree hemorrhoid? There are other surgical process that you can use to correct third degree hemorrhoids. And sometimes even the second degree hemorrhoid, there are some antibiotics, anal suppositories they prescribe for patients to put in their anus, and with time they will become fine. But the best amongst, which is usually obtainable in all teaching hospitals, is what? The hemorrhoidectomy. Hemorrhoidectomy is a surgical procedure to what? Excise these hemorrhoids, correct the bleeding, and what? They eventually do what? Stop you from having protrusion of the hemorrhoids. Now, this is common between the ages of 35 to 65. Hemorrhoids is quite common. But sometimes when the person is above 60 years and is still having hemorrhoid, it calls for alarm. Sometimes it is not just hemorrhoid. The blood may not even be from the hemorrhoid. It could even be from the colon. Because it is common, the person may even have colon cancer. He may not be aware. So bleeding from the anus, you would think that it is just hemorrhoid, not knowing that it is not actually hemorrhoid. It is what? Colon cancer. So when a man that is above 50 years keep having, in fact, even though a man is not, you are above 50 years, you are not even bleeding from the rectum, it is very important at least do a what? An endoscopy, colonoscopy. A colonoscopy is like a tube They will pass it inside the anus, pass through the rectum, and they will see the colon to see if there's any growth inside the large in the colon. But if it is there's another one they call sigmoidoscopy. When it gets to the sigmoid, they put it inside and ensure that it gets to the sigmoid. They will check if there's any outgrowth of tissue or tumor in that place. So if it happens, there are other treatment that will follow up. So, but let's take note that sometimes if you are a man or you are a woman who are you are up to 50 years, you now see that you pass stool that comes out like goat seed, the way goat shit is, and you come out, the stools don't come out like real stools. And when it comes out, you see streak of blood on the stool, you know that there's trouble. It is advisable for you to go and do what? A colonoscopy, to be sure that you are not carrying colon cancer. Now this is hemorrhoids. Hemorrhoids, the first thing you do when you have hemorrhoids, first thing, you are losing blood, you may not be aware, you need to do what? A complete blood count to be sure that or PCV, packed cell volume, to be sure that your blood is optimal. They will do a colonoscopy for you to be sure that the blood is coming, to find out if it is either from the colon or from the hemorrhoids. Okay, now when you are done with this, and then the doctor will now determine if it is a primary hemorrhoids, first degree hemorrhoids, second degree hemorrhoids, third degree hemorrhoids, and fourth degree hemorrhoids. The treatment depends on the degree that it is. If it is external hemorrhoid, it is simply they excise it, and that will be enough. And they'll place this person on antibiotics and blood medications to do what? Replenish the blood. Now, how about rectal prolapse? I wish I can show videos and pictures so that you can differentiate between rectal prolapse and hemorrhoids. Rectal prolapse is actually more common in children. You see them that probably they have long-term diarrhea, they are malnourished, they lost fats in the anus, they lost fat in the anus, they strain. It can result to what? Rectal prolapse. It's common in children, and it is even much more common in female than male. It is 6 times more common in females than male. Most times, rectal prolapse do not bleed, except it has become infected or it has become gangrenous. Then it bleeds and it becomes painful. Sometimes when rectal prolapse comes out, what you do is you see them. It comes out as a bulk. You see it come out like hemorrhoids that come out small. Rectal prolapse comes out, it's big. You have to use your hand to push it in. 1, long-term diarrhea, malnutrition, loss of fats, straining, especially women, that sometimes it occurs in women who have undergo long-term straining, long-term push. They can have rectal prolapse. So there is a great difference between rectal prolapse and hemorrhoids. The rectal prolapse, when it happens, depends on how severe it is. You can actually treat it medically. There are some oils, some injections that are given that will treat your rectal prolapse. It goes back, and that is all. Sometimes it is so severe that they had to do surgery, return it back, and they use surgery to secure it. That is when it is on the extreme. It has become so severe. So take note, there is difference between a rectal prolapse and hemorrhoids. So when next you have a push out from your anus that is bulky, that is reddish, usually rectal prolapse are very reddish, they are large, it comes out in bulk, the stools come out, you have to use your hand to push it in. That is rectal prolapse. Most times it does not bleed. Why hemorrhoid, it bleeds. Sometimes the first degree will not come out, though you bleed. Second degree will come out, you can use your hand to push it in. It's not as large as the rectal prolapse. So, and rectal prolapse will not bleed except it is infected, except it is gangrenous, except it is long that it has been injured, then it bleeds. So the treatment for rectal prolapse and hemorrhoids are different. Hemorrhoids, you do sit baths, you ensure that you no longer strain, you ensure you treat your underlying constipation, you treat your underlying diarrhea, you do sit baths, they give you some medication, anal suppository you put in there, and you correct it. If it is so severe, then you do what? Hemorrhoidectomy. The rectal prolapse, it comes out, you push it in. There are injections they place in there. You dietary modification, you ensure that you feed this child much, well, and you treat whatever symptoms such as diarrhea and constipation, you treat it. If there is cough, you treat cough. Whatsoever cause serious straining on them can result to rectal prolapse. So this is just the differences between rectal prolapse and hemorrhoids. Then the colon cancer, just as I said, the colon cancer, once you are above 50 years, you are seeing blood in your stool, it is something of importance. It is something you need to run to your doctor to be sure that this is not colon cancer. They will do a colonoscopy for you. Colonoscopy is like a tube they put inside your anus. They put it inside your anus through, and they check the colon and to be sure that you are not having any growth inside your colon. Okay, so just like I said, there are a lot of things that can result to anal bleeding. One, I said it before, hemorrhoids, infection, anal fissure, peptic ulcer disease, Crohn's disease, in fact, lots of them, Crohn's disease, angiodysplasia, colon cancer, all these can result to anal bleeding. So when you see it, they must differentiate the cause why this person is having rectal bleeding. So when next you see yourself having rectal bleeding, please, it is very important for you to do what? See your doctor, so that he can make a differential diagnosis to be sure that what is coming out is actual what it is. It could actually be from upper parts of your intestine, which comes out as a dark tarry blood, as seen in in fact your stool can be black, as seen in ulcer. It could be bright red. When it is coming from down close to the rectum, it could be bright red. When it is anal fissure, it could be bright red. These are just, they need to differentiate what is actually bringing out this bleeding. Okay, so this is just a little differentiation between hemorrhoids, rectal prolapse, and what? Colon cancer. Colon cancer, the person will be losing weight. The person will have, sometimes it just starts, the person will not even be losing weight. Initially, the person will be passing stool. The stool will look like, will be coming out like that of the way goat stools comes out. Sometimes when it comes out, it becomes like chain, and there will be streak of blood on it. This is a telltale sign that this person is having colon cancer. In fact, any man above 50 years that is having bleeding per rectum, it is very important this person run to the hospital and do what? A colonoscopy, and to be sure that this is not what? Rectal cancer, colon cancer. If it is colon cancer, they do surgery, they remove that part of the colon, and that person will be fine. provided that it has not spread. Sometimes it happens, people don't even know it. It spread, the person become cachectic before the person knows that he has cancer. Already there's nothing anybody can do again. Now take note, hemorrhoids occurs between the ages of 30 to 65 years. Rectal prolapse occurs in children and sometimes adults. Whenever you see something like that look like hemorrhoid in children, most likely it is what? Rectal prolapse, until proven otherwise. Colon cancer occurs in people that are above 50 years. So anybody that bleeds per rectum that is above 50 years, we are likely dealing with what? Colon cancer. Thank you so much. I hope I have been able to demystify the myths surrounding hemorrhoids, rectal prolapse, and colon cancer. Thank you so much, and have a wonderful night rest.